Facebook friends. We're here today with Dr. Voelzel again, and we're talking to you about something really exciting, and that is stem cells. You might have heard about stem cells in a variety of different contexts, but today we're going to talk to you about how stem cells can affect your pet's life. I can personally attest to this, and you might remember Sajmal, my 7-year-old black pointer, who is the love of my life, really. Sorry, it's my husband, but he really is. And he really came down with some back pain about 2 years ago. We thought, maybe getting old, and but really there was more, because he couldn't jump into the trunk, he couldn't really get on the couch or off the couch anymore. He was definitely acting painful. So Dr. Voelzel came to me and he asked if I wanted to participate in this really amazing stem cell treatment, which we did, and he's going to talk to you more about the process. I don't want to take it away right here, but a year later, I can tell you that Sajmal has rejuvenated. He's found his old puppy self, and he's jumping, he's running, he's swimming, he's getting into the car, out of the car. He's a different dog. So this is amazing, and I really hope that if you have a dog who's also struggling and might have some pain, that you consider this for your puppy, because there's so much to gain from this. So with that being said, I'm going to turn it over to Dr. Voelzel, who will share with you a little bit about the process, and I'm going to ask him some questions. As always, if you have any questions, please ask them in the comment section of this video, and we will get you the answers as soon as possible. So with that being said, let me introduce Dr. Voelzel to you.
Hello everyone, how y'all doing? As Annika said, we're here today to talk about stem cell treatment in both dogs and cats, and it's definitely exciting. It's new. I say new. It's something that's been around over 10 years in the animal world as far as commercially available treatments. It's evolved over time and they become easier. So we used to collect fat from a dog or a cat, and get the cells from that, which essentially involved the surgery to do it. Now we are able to get the cells out through a blood draw, which is a much simpler process, generally not requiring even sedation, although there are occasional patients that might need to be sedated. But a much simpler process to collect the cells. The cells that come up through the blood draw are a little different than the fat-derived cells. We believe more effective, last longer. So there's some added benefits as well, just besides the ease of collection. Yes.
I have a question. So you say blood draw, is that something scary or something? What happens there?
So we most often we collect from the jugular vein, which is in the neck. It sounds bad per se, but it's really not. I think it's relatively simple. We do it every day, multiple times a day, when we draw blood for doing blood work for anesthesia and all that kind of stuff. We do draw a larger volume of blood for this, so we're trying to get as many of these cells as we can, which helps us get better results with the treatment. But it's a little needle stick would equate to getting a vaccine and that kind of thing. So I wouldn't associate a lot of pain with the collection of the sample. And like I said, a much simpler process than a surgery to collect fat.
That's good. That's really good to know. I'm sure that eases your fears too. So what happens next? So we collect the blood. What happens with that?
So we collect the blood, and it goes in some special tubes, and then that's sent over to a lab that processes the cells and essentially collects the cells that we're looking for. Because there's lots of cells in blood. We're looking for these pluripotent stem cells specifically. And so they've developed a way to purify and collect these. They've known that the cells were there for a long time. No one could get them out till the last 5 to 10 years. And so the cells are collected and concentrated, and then depending on what kind of treatment we're doing, whether we're injecting joints or doing IV injections, we may get it in a couple different formats for the specific treatment. But the cells are sent back to us a couple days later. We're doing the injections. And for joints, classically they're injected into the joints, so arthritis, that kind of stuff. Your dog, we did kind of area injections, and then they also all got an IV injection as well. There's some things that are going to be treated more with IV medications, or stem cells. We're looking at, for example, we're going to be starting a study for kidney disease with these stem cells, and looking at their ability to slow the progression, or even improve the kidney values on the lab work. And ultimately the goal is to prolong those pets' lives. And there's been, I know of a couple of interesting cases where they saw some very significant improvement with these guys. So we're trying to do a little more formal study and get some better information to know what's going to work best. Lots of other uses, some of the immune-mediated diseases that it's used for, but it's being looked at for a lot of other things as well. And I think we'll continue to see stem cell therapy in pets and even people grow as we learn more about what situations to use them in, what situations they work in. But I think there's a lot of opportunity for us using these cells, and I think it'll change a lot of the ways we do things currently as we get a better understanding of the cells and how they work, and again what specific things that they work best in.
Okay. I have one more question about the process. So you were talking about 2 days later about the patient needs to come back, and is that does that require hospitalization? Is that like a couple of hours, or what does that look like for the patient?
Yeah, I mean, I would say it ultimately depends on what we're doing. If we're injecting joints, we need to sedate them to do that, and so they'll stay with us, at least a few hours. If we're just doing an IV injection, that's going to be a little simpler process. We would like to watch them for 30 minutes to an hour after injection, just make sure they're doing well, and then they should be able to go home. And that would be a quicker process. The joint injections, we'll sedate them, or in certain situations we might put them under general anesthesia, and that's going to be on a case-by-case basis based on how many joints we're injecting in the particular patient and their health, and allowing us to decide what's going to be best.
Okay. And what about follow-up or care exams, or is there a general time frame on which we can see results potentially?
Yeah, I mean, I would say most of these guys will see a response within 6 weeks. Some within a week or two. Others take a little bit longer. As far as follow-up, I generally try to check them in a month, and 3 and 6 months later. Just to see where we are, how things are going. After that, just it depends on how they're doing, and and their disease process. What we don't fully have a handle of yet is how long these cells work, and so it's possible some of these dogs will need a retreatment down the road, or cats. Sorry, cat owners, I didn't mean to leave y'all out. But it is one of those things that we're still learning about, and that's part of like the study we talked about. Part of what we're also be looking at is how long does it help? Is this something that needs to be retreated, or is it a single treatment? And that kind of information that we don't know yet.
Awesome. Well, thank you so much, Dr. Voelzel. That was great information. I'm sure you guys are just as excited as I am about this, and if you would like to learn more, you can either ask away here in the comment section or call the clinic, or shoot us an email, get in touch with us. We have lots of great information for you guys, and we hope to see you soon here at Westlake. Bye.